And we're glad you're here with us, everybody. Happy Friday to you. I'm Michael Wooten alongside Kate Welshofer, and we're going to start with that big news involving booster shots because we know you have a lot of questions.
Yeah, a few things to keep in mind here. The Moderna booster is only half the dosage of the original. The FDA recommends high-risk Americans get their boosters 6 months after the second shot, meaning a lot of people are eligible right now.
Yep, this is not going to make sense because we didn't take this at the right time. So this is, again, the half-dose Moderna vaccine that, again, they're saying for high-risk Americans, they need 6 months after their second shot. We'll go to the next one here and show you J&J's version is a little bit different. The experts suggesting that all people who got the so-called one-and-done dose need to get a booster 2 months later for that one.
So joining us live right now is Dr. John Sellick, hospital epidemiologist with Kaleida Health. As always, Dr. Sellick, great to have you with us.
Thank you for having me again.
So, doctor, to be crystal clear, anybody who got the J&J shot 2 months later, you can get a booster. It does get a little more complicated when you talk about the mRNA vaccines. I want to start here by listening to what the CDC director said this morning about those Pfizer and Moderna boosters.
If you're over 65, if you have underlying medical conditions or live or work in high-risk places, live in a long-term care facility.
So those are the categories, Dr. Sellick. Over 65, you should get a booster. We all get that, right? But the questions that we're hearing the most right now are about people with underlying health conditions. What does that really mean? And then working in a high-risk place. People wondering what constitutes that. So for people watching right now under 65, who would you advise to go and get a booster?
Michael, this is essentially the same as what they did with the Pfizer vaccine a couple of weeks ago. So what we're looking at, obviously, as you point out, the older age group, clearly the highest risk of a significant disease. The middle age group, that 50 to 64 group, you're looking at people with significant underlying diseases where they are more likely to have a bad outcome, either more likely to get infected or more likely to have a bad outcome if they do get infected. Now, the very immunosuppressed people, we already had information for them to get their third dose. But for these booster doses, 65, the 50 to 64 with significant underlying diseases, and then a broader swath of people who work in situations where they are more likely to get infected. So people who work in healthcare, congregate settings, prisons, a variety of places like that. Now, the CDC did promise us yesterday at the end of the advisory committee meeting is that they are going to be coming out with a torrent of data in many different formats for people to be able to sort this out a little bit, but it's not too terrible. And as you point out, the problem with the J&J vaccine is that the level of protection did not hold up as well as expected from that single dose vaccine. So what is being asked is that everyone over the age of 18 who got the one dose of J&J vaccine get another dose of a vaccine, either the J&J or one of the mRNA vaccines.
One of the other big questions that we continue to hear is how do you prove that you're eligible for a booster? We're hearing that you self-attest. So let's say you work in a high-risk environment, but you're relatively young and healthy. Should you talk to your doctor before deciding that?
I think it's always a good, reasonably good policy to talk to your primary care physician before you do it. My understanding is that by and large, nobody's asking you to bring a certified letter saying that you absolutely are or are not in a group. What we're really trying to do is make this happen in kind of a rolling format so that people who are at highest risk get in and get it done right away, especially before the winter season coming up. And then I think eventually much larger groups of people will be able to get the vaccine, but always good to talk to your family doc first.
Finally, Dr. Sellick, we're almost out of time, but I want to ask you about that Johnson & Johnson single-dose vaccine. You just mentioned you didn't get quite as high a protection as with the mRNA vaccines. I've heard some doctors say that if you're a J&J recipient, your booster should be Pfizer or Moderna because we are allowed now to mix and match these when it comes to the boosters. Right. Would you advise that to someone who got J&J?
I think it's a reasonable idea. There was a study that the NIH did with all the permutations of which ones you got first and which ones you got second. And the people who got the J&J and then got another J&J had a good boost in antibodies the people who got the J&J and then got one of the mRNA vaccines got a much higher boost in antibodies. But again, that's one measurement. That's the antibody measurement. Doesn't really get into what the level of protection is. So I've been telling people whatever you can get your hands on is what you should go for.
Always appreciate the perspective. Dr. John Sellick, thanks so much and have a great weekend.
You too. Be safe.